I will invite Professor Neil Perry, who is a Chief Economist for the Centre of Western Sydney, who is about to give us a talk about distribution analysis from the perspective of tackling physical inactivity. Thank you, Neil.
Thank you, Sam. Hello, everyone. So I'm Chief Economist in the Centre for Western Sydney at Western Sydney University and also the School of Business. So the Centre for Western Sydney is a research and advocacy group. Basically it comes out of the Western Sydney University Act to promote the development of Western Sydney. So we set up the centre out there to do research and advocacy about the centre and basically looking at historical inequities in funding and transport, infrastructure and things like that, which ultimately have left the economy of Western Sydney as a peripheral economy to the core economy in the east, which we argue doesn't have to be the case at all. In fact, Western Sydney has been growing at an incredible pace over the last 10 years. It's grown faster than the rest of Sydney since 2016 and by a lot faster as well. That's kind of what we do out there. We do basically economic development work and we do economic evaluations, cost benefit analysis for infrastructure programs and projects. And also in the School of Business, I created the cost benefit analysis subject for our students in economics, which at the time was the only one required. It's the only degree required cost benefit analysis. I think UQ does now as well, I just heard. But that was a really good thing, producing economists of the future. This particular work, so actually I was asked to do this and speak to the issue of distribution, which is a big issue in cost benefit analysis, doesn't really get talked about too much, even though it's fundamentally an important principle in determining costs and benefits. And to do so, I was just looking at this issue of inactivity. So this is around a report that we did last year. We did this report for free as something that we really believed in. It was for a group called Western Sydney Moving, which itself does all its work for free, trying to get people in Western Sydney very active to reduce the healthcare costs and productivity costs of health problems. So basically in Western Sydney, we have a range of obstacles against physical activity. Socioeconomic factors, you can see down the bottom there, we have much lower income, even though we've been growing a lot faster over the last 10 years. That is not really catching up in the sense of income at the moment or productivity. The economy's growing, but the income's going elsewhere, basically. So we're still not catching up. We still have a lot lower levels of income, and that creates barriers to physical activity. There's also cultural and linguistic barriers, and there's inadequate infrastructure. There's less parks and tennis courts and every other type of activity, fields and stuff like that per capita out in Western Sydney than there is in the rest of Sydney. And there's also limited transport connectivity, which stops people from getting to those activities, but also means that they're travelling to work most of the time from far out in Western Sydney into the CBD. So that reduces the amount of time for physical activity. And of course, there's heat vulnerability out there as well, which is a barrier to physical activity. So yeah, it's principally those lower social incomes that's driving this stuff though. And I'll come back to those two figures at the bottom there when trying to talk about how we use distributional weights to, value different projects. Here is a picture of Western Sydney in case you don't know. So we kind of describe it as bordered by that, the Hills Shire, Parramatta, and then round to Canterbury, Bankstown, and down to Campbelltown and Wallandilly and everything west of that. So it's 13 LGAs out in Western Sydney. And this is a map which shows the vulnerability in terms of socioeconomic disadvantage. Fairfield there, I think, still is the lowest of the 128, is it? LGAs in New South Wales. I think they're still the lowest in terms of socioeconomic advantage. There's obviously a lot of big difference there, right? You've got the Hills, which is pretty wealthy, pretty well off. Parramatta's pretty well off, and then you've got Fairfield, which is probably the lowest in the state in terms of socioeconomic disadvantage. So in the report, we pulled out some data from all the local health districts, and these figures describe insufficient physical activity in adults and children aged 5 to 15 years. I think inactivity is described as, correct me if I'm wrong, anyone that knows, but for adults less than 150 minutes in 5 sessions of vigorous activity or something like that. This wasn't my part of the report. And then children, I think it's 60 minutes a day. So this is the amount of people that don't reach that level. So you'll see they're a lot higher in the lighter coloured blue. They're all these southeast, western and Nepean Blue Mountains local health districts compared to Sydney, northern Sydney and southeastern Sydney. And that's for adults on the left and children on the right. So you see that's a big problem, a big difference, and it's going to lead to big health problems. Just more figures on that. Participation in sport at least once a year from AusPlay. All these references are in the report, which is available online at our website, Centre for West Sydney. So there you see adults and children in Western Sydney have less participation in sport on a yearly basis. And just on the right, they're starting to look at those risk factors. The prevalence of heart disease risk factor from insufficient activity is much higher in Western Sydney, like Blacktown, Parramatta, and southwestern Sydney compared to the eastern LGAs and regions. There's also diabetes and obesity that's going to come from inactivity. So there's a lot of different estimates there, and that depends on whether they're just taking what people say in the census or whether they're looking at, predictions of what's going on, a lack of reporting, so non-reporting people as well. But you see there's obviously higher levels of obesity in Western Sydney population than there is in the rest of Sydney. The Southwest Sydney Primary Health Network even estimates obesity rates at 23.6% in Southwest Sydney. Then you've also got Heart Foundation area showing the highest rate of heart-related hospital admissions in New South Wales in Blacktown and much higher risk factors, again, due to that inactivity. So we have this situation where there are barriers to activity in Western Sydney, and this is linked to economic conditions such as low income, inequitable historical funding of infrastructure, and heat. So the work that I did on this report was really around the cost of inactivity. I'm not going to dwell on this much. I want to get to the distribution stuff, but just to let you know how we did this, like I said, it was pro bono. So we just used a benefit transfer approach. There's basically 3 different levels: healthcare costs, productivity costs, and the cost of mortality. In terms of the healthcare costs, we used the Australian Institute of Health and Welfare report, which links activity and type 2 diabetes, as well as bowel cancer, dementia, coronary heart disease, and stroke, as well as uterine and breast cancer in females. So 2.5% of the disease burden in Australia is linked to physical inactivity. So we just used basically the Australian data and proportioned that to Western Sydney based on population. Productivity cost. The physical inactivity reduces the productivity of Western Sydney's resident workers by causing absenteeism and presenteeism. The latter is turning up for work but not really being physically able to contribute to work as much as you would be if you're a physically active person. And we used an older report from KPMG Econotech, which estimates the average labour productivity lost from physical activity is 1.8 working days per worker per year. And we used that figure multiplied by worker productivity and came up with a figure of 1.03 billion per annum in Western Sydney alone. And then the cost of inactivity due to mortality cost was, again, looking at physical activity causes mortality, and aside from any emotional trauma, it deprives the economy of extra workers. So we looked at basically the lost workers, again, times the level of productivity in Western Sydney. And there was 2 estimates there. So we came up with a total cost of about 1.2 to 1.76 billion in Western Sydney 1.5 billion as a summary. So that was the report, and the recommendations, which I'm going to talk about, one of these in particular, basically was to adopt a systems approach. This is because it's a systemic issue, right? It's related to income. It's related to lots of different factors. So we need really good programs. We need fields. We need all that kind of stuff. So we need a systems approach. We need a preventative approach, not a reactive system. And we need to get over those cultural and community barriers. The one I'm going to look at most is this: invest in and activate spaces in the most marginalised areas, because that speaks to the distributional issues here, and also empower systems leadership. And we're helping Western Sydney Moving to approach governments, for example, and get the programs that Western Sydney Moving is suggesting into Western Sydney. So in terms of distribution, so again, I'm concentrating on that recommendation: invest in and activate spaces in the most marginalised areas. So how do we justify that? $1 of expenditure is beneficial everywhere. It could be beneficial building a tennis court in, for example, Mossman or somewhere like that. A rich area in Eastern Sydney is still beneficial. So how do we justify spending in those marginalised areas? That requires a distributional analysis. And if we look at the New South Wales guidelines, they do now talk about distribution. Well, they always have, really, but they kind of emphasise it a bit more now. But what they're talking about there is a focus on transfers between stakeholders when there's new projects or policies. So, for example, a policy might hit consumers more than producers, or it might hit taxpayers and benefit both consumers and producers. And they're looking at those transfers and seeing whether some change is needed there. It might be low income versus high income. It could be based on age brackets, gender, or any other thing, but it's principally about the transfers between those groups. They do suggest compensation mechanisms could be appropriate if there's large distributional effects, for example, on low income people, but that really speaks to standard Coldall-Hicks compensation test, Pareto efficiency in general, in cost-benefit analysis. There's no real mention of distributional weights in the New South Wales guidelines, and nor is there in Infrastructure Australia, as far as I can tell, or other jurisdictions around Australia. There is in the UK Green Book, at least they do talk about it, distributional weights. I think there's more work needed here, like comparison about distributional weights across different countries, Europe and the US. But at least we know the UK Green Book does talk about it. So, a bit of fun, like I say, I teach cost-benefit analysis. So here is a standard kind of way to describe why we need distributional analysis. This is from Harburger's classic 1978 paper on distribution. It's also summarised in Boardman, the classic textbook. So what you've got there is an excise tax on a luxury good, which is going to be collected and transferred to lower income people or welfare recipients. And what we see is that there's going to be a reduction in consumer surplus. These, of course, are for the richer folks who are being hit with this excise tax. It's being passed on to them as supply shifts left. So consumer surplus falls by the areas A and B. Producer surplus falls by the areas C and D. The welfare recipients get A plus C, or at least part of that. There's got to be some administrative costs associated with collecting the tax and giving out welfare payments, but they get most of that A plus C. And society, of course, loses the deadweight loss B plus D. But that's still justifiable. We do it all the time. So we redistribute income. And it's justified on the basis of diminishing marginal utility. It can be justified simply on the basis of fairness, but if you want to look at an efficiency perspective, it's justified on the basis of diminishing marginal utility. So just to go into those different ways of justifying that a bit more. Diminishing marginal utility of income is basically inherent to orthodox economics. It basically says that utility increases more for an increase in income or consumption for that matter, at lower levels of income. So it matters more. If you've got less, the increase in income, increase of $1 matters more to you. Yes, that's calculus. That's the first derivative of utility with respect to income for low income people is greater than the increase in utility from a change in income for high income people. And if you're going to apply that framework, you come up with a weighting based on, roughly speaking, the average income divided by the income of low income people to the power of the elasticity of marginal utility with respect to an increase in income, which I'll talk about more in a second, which is derived from the utility function. Most utility functions lead to something like that, though, if you're going to derive the weighting. The average could be just the high income person at the top there in the numerator. It could be just the high income utility. In this case, I'm just using the average, though. So that's one way to define the distributional weights. Another kind of justification is a normative statement that income should be more equal, which is fine, even if there's no diminishing marginal utility of income. Even if you don't assume that, you could still say that a more equal society is preferred, and that leads to distributional weights. People then might argue that there's probably a better way to redistribute income than to look at project by project weightings on different infrastructure projects, for example, and how they're going to hit low and high income people. For example, taxation might be a better approach to look at income redistribution. And the third one is that the willingness to pay depends on the ability to pay. So this is the one person, one vote principle. So basically, if you're going to do a contingent valuation study or something like that, rich people have more say because their willingness to pay is going to be higher given equal preferences to lower income people. So the ability to pay of rich people is higher, so the willingness to pay is higher. So we can correct that by applying weights, and the way I'm suggesting to do it is to use the marginal utility of income. So let's look at that specifically for the issue of inactivity. So concentrating on that, invest in and activate spaces in the most marginalised areas. So the first way I was thinking about this is the fact that you've got different ambient levels of resources dedicated to those activities. So just a simple way to think about that, there's more tennis courts in Mosman per capita than there is in Fairfield per capita. So there's different ambient levels. So you've got less resources currently dedicated to activity in Western Sydney. Low levels of walkability, less parks per person, greater heat vulnerability. So you've got lower levels of council. You've also got lower levels of council, cultural and recreational expenditure per person. And I just looked at the council records for this. Western Sydney spends $231, that's all the councils on average, $231 per person per annum on cultural and recreational expenditure. The rest of Sydney, $328 per person. That's not just their decision, that's about basically how wealthy those councils are. They get different rates and stuff like that. So in all those measures, actually, Western Sydney is lower than the rest of Sydney in terms of paying for those cultural services, those social services. But what that means is that the incremental benefit in low resource areas like Fairfield in terms of tennis courts should be higher. So that's again related to an increase in marginal utility argument, a diminishing marginal utility argument. So that would be reflected in contingent valuation studies or hedonic pricing models. So when we ask people in Fairfield, would you be willing to pay for a tennis court? And there's none there, you'd expect it to be quite high, right? Mosman, not so much because there's heaps there. But again, we come back to that ability to pay thing. Okay, it might still be higher in Mosman because they've got a higher ability to pay. So there might, in fact, lead to, whether it's a contingent valuation or a hedonic pricing model, it might actually be that there's still a higher willingness to pay for a tennis court in Mosman than the non-existent ones in Fairfield. So that brings us back again to distributional weights. So we could apply the issue of distributional weights to this problem, as inactivity is correlated with lower income levels. So $1 of expenditure on creating activity is worth more. So this includes the cost of integrated programs. So we're not just talking about physical activities here. Obviously, getting people active in Western Sydney, and that's part of the Western Sydney Moving programs, is information, education, all those types of things. And the actual cost of that I pointed out at the start of 1.5 billion would then be higher because we're applying distributional weights. And I'm just going to finish by showing us how to do that. So really, it's pretty easy to get the average income, right? And the income in the rest of Sydney in terms of that weighting equation, or the income in the rest of Sydney divided by the income in Western Sydney. The difficulty is trying to get the elasticity of marginal utility with respect to income. So there is some studies out there that does this, and I think there's a lot of work that we need to do on this, but it's possible to do. Surveys, for example, come up with an elasticity of 1.2, so that's the percentage change in utility for a percentage change in income is 1.2. In Australia, Scarborough and Bennett have done a choice modelling framework. You can look at literature like Fujiwara, who've looked at all the different methods and come up with about 1.19 to 1.34. Personally, I think we can use the personal income tax structure. This is related to Fisher and Ramsey in the 1920s and discount rates. But basically, if you want to look at the Ramsey equation to estimate the social rate of time preference, you need the elasticity of marginal utility with respect to income. And the way that they've done that, and it's an example in Evans and Caesar, that you can use the marginal tax rate because that reflects society's valuation of an extra dollar to a rich person compared to an extra dollar to a poor person, at least in theory, right? I don't know if it accurately is, but it's a way to do it. I actually did this with a friend of mine, Sriram Shankar from Monash, and we came up with a figure of 1.87. That was before the stage 3 tax cuts last year, so that could change a bit, but that's quite a high level. If I'm going to apply that, I'm going to use, that equation that I showed you earlier, the rest of Sydney divided by the Western Sydney income, average income. If I use an elasticity of 1.2, then I'm going to come up with a weighting for Western Sydney of 1.6 and a weighting for the rest of Sydney of 0.6 for every dollar invested in activity in those two different regions. If I'm going to use the one that Sriram and I did, 1.87, that's a weighting of 2.2 for every dollar spent in Western Sydney compared to 0.5 for every dollar spent in the rest of Sydney. So you can see there's quite big differences there when we apply weights to the expenditure. In this case, and specifically, I want to talk about activity here. It might not be appropriate in every circumstance, but because activity is such a fundamental result, inactivity is a fundamental result of socioeconomic factors, I think it's really appropriate. Then we're going to apply those particular weights. So let's see, just in conclusion, if we don't apply those distributional weights, we're either arguing that project selection is not the best way to redistribute income, and efficiency and distribution are separate issues in orthodox economics. But in this case, there's an efficiency and distributional argument that come together, and that's through the marginal utility of income. If you take that there is a diminishing marginal utility of income, then it is efficient actually to apply higher levels of spending where they're most valued in those lower income levels. So that doesn't take into account that issue of the efficiency properties of applying weights. Or does it? Alternatively, it's about basically they don't care about one person, one vote, and that comes back to the ability to pay issue. So, finally, weights can be applied. And I think there's work required there. I think estimating the elasticity of marginal utility with respect to income needs a lot of work. And comparing, I think, Australia and different distributions in Australia, different regions in Australia, on how they think about weights and their opinions about weightings in cost-benefit analysis needs to be looked at and compared across the world. But basically, the targeting of marginal areas of investment in activity can be justified on multiple different grounds. There's some references. The others were in the report, which is available on our website, and there's a nice colourful picture. Thank you.
Much, Neil. I'm going to exercise my right from the chair to ask the first question. In an earlier slide, you said the reason we care about this is because people in Western Sydney, because they have less access to the space to exercise, might not they'll be unhealthier. It might lead them to earn less, and their disposable income may be lower because they're spending more on healthcare. If that's true, and their disposable income does change because we put this in, implement this program, in our calculation of the distributional weights, should we use their previous income of $90,000 per year,
Yep.
or a new theoretical disposable income of maybe $92,000 per year?
Before you're weighing it up or afterwards?
When you're waiting.
No, I think when you're waiting, you use the actual income. I think if you reassess it down the road, then you'd use, if there's higher income, then you'd use the higher income level at that point. But I'm not really suggesting that higher levels of activity are going to increase their income, not necessarily. Mm-hmm. I'm saying it's going to increase their health, which reduces health costs, increases productivity in the economy, and those types of things. It could well increase their income, but that's not what I'm suggesting.
Okay. Are there any questions from the floor?
Maybe just a clarification for me. If you were not applying distributional weights, then theoretically the impact of those tennis courts in Fairfield should produce greater benefits compared to Mosman. So I'm just a bit confused in my head that then, doesn't that mean that's already reflecting the marginal utility? Because
there's less tennis courts in Fairfield? Yeah. So it would do if they all had the same income level, right? If Mosman and Fairfield had the same income level and there was less tennis courts in Western Sydney, then people in Fairfield would say the value of a new tennis court is much higher. Yes?
Yep.
But because they have lower income, their ability to pay is lower, and therefore their willingness to pay is lower. Okay. So if they're expressing themselves in a contingent valuation study is the easiest way to think about it, then they're going to express a lower willingness to pay because they have a lower ability to pay.
Okay, so it's to correct that factor.
You can say it's to correct that. Yes.
Okay. Thank you.
Yes.
Hey, Hamilton. Just building on that, could you use a broader willingness to pay that would include, say, like an average of all of Sydney? Would that correct in some way that willingness to pay?
That would help. That would help. Yeah. It probably wouldn't get quite to it because you're still using the average, right? So the Eastern Sydney people are bringing that. Yeah.
Still skewed. Yeah.
Yep.
Making you walk. Hamish Barnett, KPMG here. But Neil, I spoke to you a little bit when I was in Infrastructure Australia. So very
Hamish, how are you?
Factors. I think that the fundamental one for me on this is that the distribution weighting is I guess for decision makers, and
Mm.
if you're developing a sort of Sydney-wide decision metric, it would be for Sydney-wide decisions. Is there something else you'd kind of need to consider to, I guess, just target the local councils that are delivering this infrastructure? Might be one. I guess maybe that's just a bit of a broad thought bubble. The other one might be, this might be quite well targeted for state and national level funded infrastructure, like roads and things like that, where the state has to prioritise across Sydney, not Fairfield Council prioritising within the council as well. Just wondering if you've sort of considered that and the applicability a bit more broadly.
Yeah, totally. Good to see you, Hamish. I wouldn't put this at the council level. As I showed those figures, that is across the board. It doesn't matter which category of expenditure you're looking at. The Western Sydney councils spend less per capita than the rest of Sydney, and that's purely based on rates and stuff like that. The amount of people they've got. I mean, Blacktown Council is massive, right? Absolutely massive. So I wouldn't put this down to council and them going out there and doing things. They already do things, and they're a part of Western Sydney Moving. So Western Sydney Moving is a organisation, non-profit, that brings in, all the sports organisations, the councils, non-profits, health NGOs, but, all different people, because it is a systemic problem, and they're trying to get that together. Chiefly what we've done is gone to the state government and said, you need to fund this idea, these programs, because David Burns, who was the lead author on the paper that I'm talking about here, he's Western Sydney Moving CEO. He's done that completely for free, just off his own back. It's based on a well-researched program in Manchester in the UK. So it was Manchester Moving. But we've principally gone to the state government, health ministers and stuff like that, and said, you need to support this framework, and they're thinking about it. But, then it comes back to things like infrastructure, as you said. It's not just about this specific program, it's about infrastructure more generally, social and physical infrastructure, which, as I said at the start, at the Centre for Western Sydney, we explained there's been an historical inequity in funding for social and physical infrastructure. So we argue that this really needs to be corrected. There's 10.2% of Australia's population in Western Sydney. That's bigger than the rest of Sydney. There's more than 33% of New South Wales is in Western Sydney. So we would say we need at least that much of the funds, but we've also got to make up for this historical inequity. You look at, the most stark kind of area is the arts, right? Arts funding, I think it's 20% of Australia's arts funding goes to the rest of Sydney, and 1.2% goes to Western Sydney. And that's completely out of alignment with the population, right, of these two regions. So it's more general than certainly just looking at the councils. It's more general than the state. There needs to be more social and physical infrastructure in Western Sydney. It can be easily justified just on efficiency grounds. We've got, incredible growth over the last 10 years. We've got the airport and stuff like that. But this is an additional argument. There's lower income, and therefore the marginal utility of every dollar spent out there is greater.
While people are thinking of other questions, you mentioned this proposal's going to the New South Wales government.
Yeah.
Correct me if I'm wrong, but I think the New South Wales cost-benefit analysis guidelines don't yet recommend using distributional weights. So would you be able to tell us something about your experience in bringing this argument to the government? How is it being received? Are they open to this use in developing policy?
So just to clarify, we did not use distributional weights in this paper. This is a secondary argument that Robert Smith asked me to talk about today. So we haven't gone in there because the New South Wales guidelines don't talk about it, right? So they're not really going to listen with that. They're very receptive to the idea in general that there are larger problems in Western Sydney in terms of diabetes, obesity and stuff like that, and that they need to put funding out there. But as yet, we're yet to see them redistribute funds from the rest of Sydney in a fixed budget to Western Sydney. So limited receptivity, I would say.
Sort of leads me to a sort of follow-up comment that I often see enthusiasm about distributional weighting where it applies to projects that apply to sort of marginalized groups, because that where we would see an increase in weighting. But I don't think I see as much enthusiasm applying the inverse to projects that might be coming, to the eastern suburbs.
Right.
If I was a practitioner and my client was the clients in Bondi arguing for nice beach amenities, and I said, well, we're going to have to downgrade your cost benefit analysis because the distributional weight should be 0.5. They might not ask me back again. So that just an observation.
Well, I work for a university, so I can argue whatever I want.
Any further questions? Guys are making it work.
Thank you very much. It was an interesting presentation. I was wondering, what is the underlying reason for that inequality, for example, between Western Sydney and the rest of Sydney for arts, as you mentioned?
Yep.
And if there's any demographic issue, any demographic characteristic that caused that inequality?
Yeah, good question. I don't know if there's a demographic quality that's caused it. No. There are demographic differences between Western Sydney and the rest of Sydney. I'll have to point you to political economy to explain the inequality. It's not about an efficient allocation of resources. It's about economic and political power relations. So, a simple way to think about it is that the historical centricity of power is in Macquarie Street, right? And so that's where resources get distributed out from there. Western Sydney's way out there somewhere. Where is it? Out there somewhere, right? I go places in Sydney and they go, wow, you came from Western Sydney, amazing. And it's like 20 minutes away, right? Just down the road, Parramatta, 20 minutes in the train. So, people don't even go out there. So it's more a political economy issue. And that's really why we explain that we need equality of funding out there we say that, Western Sydney is the driver of future innovation and productivity in Australia, not just Sydney, but in Australia. And as soon as governments realise that, that's where they're going to be putting their funds and driving economic growth and innovation that's going to benefit the nation. But yeah, it's really a political economy issue, I'm afraid.
Thank you.
And Sam, I think you should find clients in the Western Sydney. That'll solve your problem. Thanks, Neil. That was really. Andrea from Macquarie University. It was a great presentation. Thank you for that. And I'm from the Western Sydney, or grew up in the Western Sydney, so I completely agree with everything you've said.
Thank you.
And then there needs to be a lot of work and a lot more attention paid to developing Western Sydney. And it is growing, but people don't seem to notice it. My question is actually quite small. It's about the elasticity value.
Yep.
I mean, you said that there needs to be a lot of work.
Yeah, I think so.
In doing that, and it seems to be the one thing that will kind of help you find the right distributional weight.
Yeah.
What are you using to pick that elasticity value at the moment?
Yes, so Sriram and I, again, Sriram Shankar is from Monash University. He's going to an Indian university soon. We used the marginal tax rates, and that's a well-established method. Again, it's related to the Ramsey equation, which is used to look at the social rate of time preference, deriving from Fisher and people like that back in the 20s. So, yeah, we use the marginal tax rate because supposedly society has chosen levels of, what's $1 worth to a high income person, what's $1 worth to a low income person. You can argue about that, right? Whether that's accurate or not, but that's one method, and that's the method we were using. Like I said, we did it before the stage 3 tax cuts, so our figure's going to change. It was 1.87, which is pretty high compared to the literature, but not high compared to that method, because in the article that I mentioned, that doesn't see, oh yeah, it's working, which was Evans and Caesar 2004. So they used that method as well, and they did it for a bunch of different countries. It wasn't high compared to that, but it was high compared to the method from the survey and some other methods. But, I think someone needs to do a literature review on this and, yeah, put it into the government. Yeah, meta-analysis would be fantastic, yeah. But that was the method we used, right? It's a well-established method. It's pretty easy to apply, yeah.
Going once, 3 times. Everybody, please join me in thanking Neil.
Thank you.